How are you, Mr. Sean Boyer?
Doing well.
Yes? How do you find us? How was the process, and what can you tell me about the way you found us?
Alright, well, I just, I was looking for something economical and something somewhat professional. And so I just started looking on the internet through medical tourism companies. I tried a whole bunch. I originally tried one. I was going to go to India, but I could never ever get a hold of anyone. And that was probably the biggest deterrent to a lot of these travel agencies was that I couldn't get a hold of anyone.
So you found KCM, yes?
I found KCM.
In Poland.
Yes, yeah. So I found a number, I called it, and actually I think I emailed someone. I think I emailed you, and it was like the next day he got back to me, or even that same day. So it was like immediate communication, which was good. So I contacted you, and I started looking into it a little bit more, and really, I'd much rather choose Poland than India. I'm going to be in a stressful situation. So what do I want to be in the middle of some big city in the middle of India, or do I want to come to like a resort? It's like going to Vail to have surgery versus going to like the middle of LA. So.
What about Mexico?
Mexico was a definite. It was a possibility, but it was not one of my options that I was considering. Just with the being so dangerous there now, just the risk was not worth the reward. It is the cost was about the same. It might be a little bit cheaper, but do I want to jeopardize, the safety?
Of course. For what exactly treatment are you here?
I'm having the DM dynamic stabilization device implanted in 2 levels. Something that they're not doing in America. I live in Denver and right by Boulder, and in Boulder they're doing the clinical trials. They're just starting clinical trials with this, and they only allow 1 level to be in the trial. And here, they've been doing 2 levels for a long time.
So you are saying that you are getting a minimal invasive spine surgery with some DM implants that are not even
used.
Public there in America?
Yeah, exactly. Yeah. So I was looking into artificial discs, and that's what I originally wanted. And so I was looking to see, trying to find an M6 disc, but with my laminectomy, it wasn't an option. So the DM was what I'm going with.
How was the service that you got here from the team and from KCM Clinic?
It was great. I had them book my flight. I could have booked my own flight, but I just wanted them to do it, or you guys to do it. And everything was great. The communication was great. It was really easy. Once I got off the plane, I was met, and they brought me right here, or right to my hotel room. It was great. Everyone's friendly. Everyone speaks English. So I went right to my hotel. I kind of felt bad because they were doing so much for me, and I felt like royalty. I was like, I'm just this little teacher from Colorado, but it really made me feel special.
And tell me, what was the know-how and experience from the doctor a factor that made your decision quicker and easier? Yeah, that was one of the things that was really put me at ease, was that I was able to call the doctor before. Because I'm a huge skeptic. Like I'm always looking. I teach high school. I'm always trying to figure out, okay, is this real? Is this fake? Is someone trying to pull something on me? So when I got to talk to the doctor, he explained to me that he's done 3,000 of these. With only 3, I think, complications, and 2 were just minor infections, and 1 was the guy was older and had a little bit of leg nerve loss in his leg. And I'm like, gee, 3 out of 3,000, do the math, that's great results, and then, he just really put me at ease. So,
Yeah, that was a big factor. Do I want to go somewhere where there's might be a little cheaper, like I'm talking a little bit, and not have someone who's experienced, or come here and have the rock star of all neurosurgeons.
Is this your first back surgery?
This will be my third. I've had 2 discectomies and 1 laminectomy.
Okay.
So, but yeah, this will be my first implant. And my whole goal was to avoid fusion. Like, I'm only 33 years old. I don't want fusion. And in America, that's everyone's knee-jerk reaction is fusion. Let's fuse you. And they're just so afraid to do anything creative or anything out of the ordinary. They just don't want to be sued and all this madness. So this is the best option.
Would you recommend the service so far for other future patients?
Definitely, yes. This was definitely, I can tell this is the right decision. I made a great decision. I would totally recommend it to anyone. I was even in the hotel, and I was talking to a guy from Germany, and he was telling me he had back pain, and I gave him you guys' contact information, and I definitely recommend this to everyone because there's no reason to be living in pain, and that's what I was doing for about 3 years. I was just maintaining the pain and kind of just living every day in pain. Trying to make it as minimal as possible, but still, not feeling 100%. I coach and I play basketball, and I really want to get back in there and
active lifestyle.
Have my active lifestyle, yes.
Mr. Sean, thank you for the interview here at KCM Clinic in Jelenia Góra, southwest Poland.